Welcome to the first in a series of presentations on malignancies of the reproductive tract, including one addressing testicular cancer. As nurses, we need to teach people about the symptoms of cancer, to listen to their bodies when signs and symptoms are present, and to contact a healthcare provider sooner rather than later when they suspect something isn't right. In women's health, cancer of the reproductive tract can occur within the pelvis, affecting the uterus, cervix, or ovaries, or outside the pelvis, affecting the breasts, vagina, or vulva. The nurse has a huge role in helping patients either prevent cancer or when undergoing treatment for diagnosed cancer. Prevention is a key role. As a nurse, you need to promote well women exams. Include what the patient should be on alert for when something goes wrong. Things like nipple discharge when you're not nursing, a breast lump, abnormal uterine bleeding, lesions on the labia. We should promote behaviors conducive to a healthy lifestyle. A good diet, ample exercise. Try and minimize the stress in their lives. Don't use tobacco products. Limit alcohol, and try to sleep at least 8 hours a day. Nurses should be well schooled in the screening exams available to detect abnormalities when small and non-invasive, such as mammograms, pap smears, teaching self-breast examination, as well as the BRCA and/or CA125 testing for those with risk factors. If a patient is diagnosed with a GYN cancer, the nurse needs to assist the patient with referrals to an oncologist, explain procedures that are done to diagnose and/or treat the condition, explain the anticipated preoperative and postoperative care, how to manage pain and other side effects of treatment, as well as addressing the psychosocial issues such as body image disturbance, loss of sex hormones, and sexuality. Post-op care for any of the GYN surgeries is typical of other surgeries. Your job is to detect post-op complications and promote healing. Provide pain and comfort management. For the wound, assess for healing and complications. After resection, the wound margins should be healthy and heal appropriately. The nurse needs to assess and manage surgical drains, as well as the return of bowel function, removal of catheters as soon as possible, assessment of the lungs, and having the patient use an incentive spirometer. The patient needs assistance to ambulate early to prevent DVT and pneumonia. The nurse also needs to promote good nutrition for healing. Treatment of cancer involves short and long-term management. The nurse needs to be available to answer questions, reiterate what was said by the physician, review the plan, and discuss her concerns. Teach the patient about the treatment team, who is responsible for what, and who is available for support. Think about how long it is taking you to learn about cancer. You get little snippets each semester, yet you still forget what it is, the risk factors for each, and the treatments directed at the various types. Your patient will need time to learn about the disorder and treatments. The nurse needs to review a patient's health history, assess and monitor the patient's physical and emotional status, keep track of the lab results, pathology, and imaging studies. Communicate those results to the physician as well as the patient. You will need to administer medications, fluids, and some of the cancer treatments. Some of you may become chemotherapy certified so that you can actually administer the chemotherapy drugs. Management of these cancers includes collaboration between the various specialists needed to treat the patient, and this includes nursing, the primary care provider, the GYN specialist, the oncologist, physical therapy, dietitian, and radiation oncology. Social services and psychologists may be needed as well. The nurse needs to advocate for the patient, make sure her desires for treatments are synchronized with the medical plan. There may come a time when the patient decides enough is enough and wants to stop therapy. In this case, the nurse will facilitate and provide hospice care. Try to involve the patient's support network as much as possible. Now move on to the individual lectures that will discuss the various cancers that occur in reproductive health.